Thank you, Jane. I feel like a bit of an interloper here because I'm going to talk about cancer diagnostics. So I didn't understand a lot of the mining talks, so I'm perfectly fine if you don't understand what I'm saying either. Cleo is a new Australian startup in the biotech space. We have been listed for approximately 12 months, just slightly over 12 months. You can QR code into the presentation and see the metrics around it if you want to. As a scientist, I'm not the person to talk to about the finances. But what Cleo is doing is we're bringing to market a simple and accurate blood test for diagnosing early stage ovarian cancers. So why ovarian cancers? People often don't realise ovarian cancer is actually the most lethal of any of the female reproductive cancers. A patient that's diagnosed today has less than a 50% chance of surviving for 5 years. Typical median survival would be about 18 months, and that's with treatment. One of the problems is there are no symptoms of these cancers as they progress. So by the time a patient turns up in a clinic feeling unwell, they've generally got very advanced and very extensive disease and literally tens or hundreds of tumours all throughout their abdomen. So at that point, treatment really is palliative. It's not curative in any way. So it really highlights two problems in the space. The first being that there is no screening test for ovarian cancer. So we know that if we can pick these cancers up early, before they've spread, we have above 90% cure rate. We know that screening works. We do it for breast cancers with mammography. We do it for cervical cancers with pap smears. But there is no screening test for ovarian cancers. We can't do it at the moment. So that's a major issue in the clinical space. The second problem, which sounds very silly to say, is that we don't have any adequate diagnostics. So for ovarian cancers, we generally use ultrasound, so that's really the mainstay of identifying these cancers. That gives you an accuracy of somewhere between 60 to 70%, which is not sufficient to actually diagnose disease, and it's only used to make a referral for surgery. That surgery is exploratory. Most patients will have a very extensive surgery. It's quite aggressive, involves removal of any suspicious looking tissue, often removal, or almost always removal of the ovaries, and a lot of health issues associated with that, as well as the fact that it's a major abdominal surgery. Diagnosis only happens after that surgery happens, okay? And here's the thing, 9 times out of 10, it's not cancer. So we've got a real problem in the clinical space. So Cleo Diagnostics is changing this. We have a worldwide exclusive license on a patented biomarker technology, which is very specific for ovarian cancers, so very good at identifying these cancers, and it's very sensitive, so it's very good at picking up all stages, including the early stage tumours. And those two things together have allowed us to actually leverage that technology and develop 3 separate testing regimes addressing 3 different areas in the clinical space. So the first one is what we call pre-surgical triage. That is basically determining very early on in the referral process whether a patient is likely to have a cancer or not. So the current standard of care using ultrasound, as I say, is around 60 to 70% accurate. We need to be better than that. And the idea there is that if we can identify those cases early, we can send them to the right surgeon quickly, without any delays. And those are the problems that we face at the moment without testing. The second test is a recurrence test. Once again, unfortunately, all of these cancers will recur after treatment. We want to know as early as possible when that recurrence is happening so that there's more time to treat and more time to develop a patient-specific approach. And then the third test is a screening test. So that's where we're looking to identify early stage disease when it is most treatable and curable, and that's the one that will save lives. So the Cleo technology itself How does it perform? Well, if you have a look in your presentation, you'll see that our test is running at 95% accuracy. Okay, it's far and away eclipses anything that's out there at the moment. That's important, and it's important to remember that that's not just for detecting cancer as opposed to not cancer. It's detecting and differentiating that cancer against the backdrop of myriad benign diseases that resemble that cancer and present in the same way. So it's really removing a lot of that uncertainty in the referral process. If we look at early stage disease, which is the one that we need to be detecting, we're actually picking up about 90% of the early stage cancers as well. And that, of course, gives us a lot of room to manoeuvre as we go forwards and develop our screening applications in particular. And I think the other thing that's important to sort of remind you is these are not just empty words. This is all backed up by about 15 years of academic research. All of the data has been published in internationally peer-reviewed scientific and medical journals. It's all available in the public space for you to download and look through at your leisure. So I can quite confidently say this is a game-changing test. So the market, I know that investors are always interested in the market. The largest diagnostic market in the world, of course, is the US. There are roughly 1 million patients eligible every year for a triage test, about the same number of tests in the recurrent space every year. And screening, of course, is the big ticket item. Essentially, when we get to screening, we're talking about every woman of reproductive age having a regular health check. So once a year, once every 2 years, in a very similar way that we do screening at the moment. When is this happening is something I'm always asked. So we are running the clinical trials for this in Australia and the US right now. We are just finalising the contracts with our preferred manufacturer at the moment, and very soon we'll be transmitting all of the reagents over, and they will be boxing them up into our first diagnostic kits. We will be putting we've engaged and fairly well down the track with our FDA applications around this first test. A pre-market notification will go in at the end of next year. So at that point we will have, or we will be very close to having an approved marketable product in the space. The recurrence and screening testing will follow along essentially the same pathway and have similar timeframes, really just dependent on the different clinical trials we need to run in those two spaces. But basically we will have something out there very, very soon. And the other really important thing, as a scientist, I never consider these things, but it's not enough to have a marketable product. You need a market, you need people to actually use it. So we've engaged very early with key opinion leaders in the space. So experts in gynecology, oncology, radiology, but they're not just experts in their fields. They are people who have very large clinical practices and who are very excited to adopt the testing. So these are going to be our early adopters of the technology. But more than that, they're also people who lobby routinely the private insurers and the government agencies in the US to have these tests in the reimbursement schedules. So patients can actually have these tests reimbursed. And that's very important for the marketing. As I said, we're running our trials now. Our aim ultimately, of course, is not just marketing, but to get these things into the clinical guidelines so that doctors basically have instructions that say use this test. And I don't think that is an unreasonable goal. So in this very, very brief presentation, I hope I've given you the idea of what we're doing, which is a simple blood test for ovarian cancer. It is accurate, it's fast, supported by gold standard evidence, and the technology really is world class. Okay, this is actually a game changer in a space where there have been no changes for a very long time. I haven't said anything about our leadership team. we have an excellent, well, I think an excellent board. I'm not including myself in that assessment, of course. But we have a board with people who have done this before. So they have a proven track record in taking diagnostics into the market. And I cannot tell you how important that is in this space. And I guess all of that really just creates the value chain for investors like you guys. So that's about all I can tell you for the moment. More than happy to answer questions later on after lunch. Thank you very much.